patient population is homeless or at risk for being homeless. So they have lots of challenges, not having a place to sleep, a place to store medications, not having money to get their medications, not having food or transportation issues.
I mean, a lot of them are recovering addicts, if they've gotten to the Daily Planet. So they're very conscious of what they're putting into their body for the sheer fact they're afraid that everything has addiction potential or tolerance potential.
The average age of our patient is either late 30s, early 40s, and chronic disease has kind of blossomed. These are individuals who typically have not had any health care, so to speak, on any consistent regimen throughout their life.
Unfortunately, they're not able to eat the way they're supposed to eat because they're homeless and they're dependent on shelters and churches to feed them. And unfortunately, the cheapest thing is sandwiches.
And this is not just diabetes, this is across the board. They didn't have the money to pay for their meds at this time, so they didn't get any this month. They haven't been on any of them.
The homeless population has they have some unique barriers. Transportation is a tremendous barrier. Most of our clients are using their feet for transportation. They'll forego treatment of any kind until it's probably close to unbearable in terms of pain. So we don't, they're not in a preventative mode.
By the time we diagnose people, they have retinopathy, they have neuropathy, they're already at end-stage disease because they have gone so long without being diagnosed or without care.
It's just very exciting for me to see how they've embraced pharmacy and how we've been sort of coming to the clinic as a team approach.
I must say that the Planet has been very helpful. I feel like I'm special. I interact with all of the physicians and all, and the workers and all. And you have to prioritize your life. What's more important to you? Your appetite or your health?
My sugar used to be 300 to 400, then it's down to anywhere from 90 to 170. I don't care what I come in with, what type of problems, they're always there to assist me.
We already paid for the medicine, but now you say, Dr. Stevens, or I don't have a ride to go pick up the medicine, or I can't walk that far, so we give you bus tickets to get there and get the medicine. So we put a system in place where you really have no excuse at all why you don't have your medicine and why you're not doing what you're supposed to be doing.
I think success looks that we've built a good system of working together with Dr. Stevens and I being able to do that we get most of our patients under control. I'd like to see good A1Cs, or at least get them, below 7. I don't know if we can get them all below 7, but a good percentage of them below 7, and getting the right preventative care and having access and monitoring.
Now I'm saying, only for 1 year? How am I going to do this only for 1 year? I want this forever. So we're already thinking about sustainability. Right. How can we keep this going? Because the patients are excited, the staff members are excited. This is like a dream team for diabetes. In a world where when I came up, pharmacy was a pharmacist and a doctor was a doctor. You didn't work together. So now we're bringing up a new generation of providers that they can learn to co-manage patients together. So we're proud of that. I want to see other health centers saying, gosh, there's a model that doesn't look hard to do. That is something that I think we can, if not do the whole program, we can take an aspect of what they did and we can do this for our patients. If these folks can do this with a bunch of homeless people, how can we not do this with our patients?